how do you feel about IV vitamin C? Is that something with patients you use alongside the diet?
So I don't do any adjunct therapies at this juncture because I am fully 100% telehealth at this point. I do work with patients on nutritional supplements and other things that we can do at home, testing they can do at home, or other treatments they can do at home. But from an IV vitamin C, I think that there's just not as robust data because the conventional world doesn't study it. And when they do, they don't always do it the way that it should be done. And so then it looks like it's terrible, and it's not terrible. A lot of conventional medicine docs think of IV vitamin C the same way they think of oral vitamin C. And they are like, oh, don't take it during treatment because it will protect the oxidative stress from the chemotherapy. And you're like, no, it's a different process. It's, so I have patients who use it. I don't ever tell a patient which treatment regimen they should follow. I now work with patients to kind of find out where they're coming from, what types of therapies are they investigating? Are they absolutely against or definitely want to include? And I try to just optimize them. And then we test. And if I'm seeing numbers going, completely wonky, then I might say that therapy may not actually be right for you right now. Or maybe you need a break. Maybe you need more healing. Maybe, so I'm just trying to give them a second opinion, a counsel, a sounding board, questions to ask their providers, and really try to work with them on the foundation.
So if a new cancer patient came to you, and again, there's a lot of nuance to this, what type of cancer stage and so on. But if they were inquiring about IV vitamin C, hyperbaric oxygen, you mentioned hyperthermic therapy, what do you tell them if they start probing and asking you, should I include these? How do you feel about them?
I totally let them do. I think there's a huge placebo effect too in almost all therapy. So if they're walking into the chemotherapy office thinking this is poisoning me and killing me, it very well could. Whereas if they're walking into the IV vitamin C clinic saying this is healing me, this is curing my cancer, this is like, that could be very powerful. So again, I try to advocate for let's look at everything. So let's look at your labs. Where are you? Where do we need to go? Maybe you shouldn't do anything yet because you're not healthy enough to do any therapy. Let's just get you healthier first. Then we can start talking about different therapies. But if somebody wants to, I just say, please find a reputable provider, talk to them. There's certain tests that might be done before offering treatment. And if they're not checking those things, then I think maybe that's not the place for you to go. Like if they're not asking these questions, then, so I do try to coach them as to what things they should be looking for. And then we just continue to monitor. How are your tumor markers doing? How are your inflammation markers doing? How is your insulin resistance doing? Like all of those pieces. And most of the times we might pull certain things in and pull certain things out. And anytime we're seeing worsening in something, well, then what you're doing maybe isn't working for you. Maybe it's time to rethink. Maybe we need to change direction.
Again, using our hypothetical, somebody with cancer working with you, and they've adopted a ketogenic diet. They're working on their mitochondrial health, their metabolic health. They have that baseline, but they want more. We already talked about the adjuncts there, the hyperbaric oxygen and hyperthermic, and what was the other one? There was 3 there.
Well, we did
IV vitamin C. That's it.
Yeah. And there's others. There's mistletoe therapy that's out there. Which is not quite as oxidative. That's more gently healing, right? I'm trying to help the body with its own immune function.
Okay. Where I was going though is supplement wise, things they can include specifically on top of that diet to have additional benefits.
This is where I start to diverge from some of the complementary or alternative natural docs out there. Is I am less about adding more supplements because they have this antioxidant property or this tumor pathway blocking property. I treat that no differently than I treat a pharmaceutical. Like that is, okay, what are we trying to do? We're trying to put a Band-Aid on a problem. Let's get back to the root of the problem. So I do recommend some supplements, but they're almost always nutritionally based supplements like vitamin D or omega-3s or something where I see deficiency in the system. And we're trying to kind of prop up that deficiency until we're where we need to be. And what I see is a lot of folks coming in on 20 different supplements because they read a book and watched this person's podcast and listened to this. And I'm thinking, I don't think, well, number one, they've never been studied together. So you're assuming that they're all going to work as they would in an isolated capacity. In addition, in the isolated capacity, we don't know how those people were eating. We don't know what else they were doing. Just like if you had hypertension and I put you on a blood pressure medicine, your blood pressure would go down. So therefore, a blood pressure medicine is what you should take for your blood pressure. But I would say your blood pressure issue was caused by insulin resistance, likely. So let's fix that. And now we don't need the blood pressure medicine. So I'm very much an anti-supplement person, although I don't prescribe anything. I recommend, I discuss the whys. I think that there are a number of folks out there who have what we call the MTHFR mutation, a methylation deficiency type gene, that sometimes they need help with methylation. So some of those, but again, I'm just trying to get all the pathways to be optimized. I'm trying to get those micronutrients optimized. I'm not trying to add pathway blockers or, and a lot of those. So we hear about antioxidants. So just maybe no one's heard this. But when we give one of these compounds in a high dose, right? So these extracts, maybe it's resveratrol or EGCG or something, they often are creating inflammation in the body, for which our body responds with our anti-inflammatory response. So maybe in the short term, are we creating a little hormetic stress that stimulates our response? But if we take that same thing now every day for the next 3 years because it's supposed to help me with my cancer, I think that the data is lacking, and I think that a lot of times we're a little bit misguided. They were used for very short periods of time. Maybe it was a couple-week trial. We don't know what numbers were before or after, what happened 6 months later. I always just keep going back to that cellular health and getting all of these processes, all these micronutrients, trying to optimize those so that our natural healing abilities are restored.
Well, the good news in all of this, it keeps coming back to, again, building up the mitochondria and metabolic health, which makes it a lot easier for people, whether they're in the prevention category or if they have cancer and they're battling. So what I'm gathering there from that last answer, reading between the lines, is that either way, when it comes to adjuncts to the diet, you're looking at just supporting the system and bringing it back into balance.
Absolutely. 100%. And that goes, for, yes, prevention and for the cancer patient. And again, I might do things a little more stringently or aggressively. There's some people who have plenty of time. Let's just do this baby steps, move in the right direction. And others, it's like, you need to do all of this today, and get you moving in the right direction as quickly as possible. So it's more about the speed and the urgency as to how I work with patients than truly what I'm recommending, because what I'm recommending is almost always the same.
Okay. So you've hammered home you're not a big fan of taking specific supplements to fight cancer, but I want to come back to something you talked about earlier, using supplements to build the body up as a whole. You mentioned a couple there. I know vitamin D was one, but I want to come back there and make sure we cover the array. So for somebody, say we'll just use prevention, or if they have cancer, what are the general supplements that you like people to take just to maintain their well-being and wellness?
I still will look at their testing, because if they're not deficient in something and then I'm telling them to take a supplement, then I'm actually throwing them out of balance. So normally what is your vitamin D level? Okay, yes, let's supplement vitamin D. What is your omega-3, omega-6? Now, sometimes I'll use some surrogates for that. I'll look at other markers and inflammation markers, et cetera, to say, wow, you're really high in your inflammation markers, so we probably need more omega-3s. We need to push down on your omega-6s. We might need to remove some other plant toxins, but of course, the worst plant toxins are always the sugars, the grains, the legumes, the seed oils. So, right, we get rid of that part and then we're getting there. I might need to have people push sodium. So many people are taught, like, never eat salts. Don't put any salt on anything, and their sodium levels are running quite low. And so sometimes I need to have them push some certain electrolytes. We might talk about magnesium supplementation. That's a common one. I feel like, especially as we transition from maybe a high carbohydrate diet to a high fat diet, sometimes we need a little support as we're kind of optimizing different metabolic processes. So I would say my most common ones are D, fish oil, magnesium, maybe other electrolytes, and then occasionally methylation support.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
This is your body saying, hey, I finally had to throw down this really big, scary word at you so that you would stop and listen, so that you would stop and look. And so now let's just work to see what is